My name is Steve Brown. I am a 56-year-old husband of 30 years, father of two, grandfather of two. Hey, good morning.
Good morning.
Ready for some coffee?
Yes.
Yeah. I've always been an athlete. I played basketball, baseball, soccer, a little bit of volleyball. I didn't discover running until probably college, and I realized that there's a true kind of a therapeutic effect on a competitive level, cycling, running, triathlons. It's a lifestyle, and I hope it remains a lifestyle for many more decades to come. I was doing Ironman Lake Placid in July of 2005, and I felt horrible. I felt like I was practically falling asleep on my bicycle during that race. I was having difficulty swallowing, solid food at first, but then liquids, and then just swallowing anything at all. It was just really, really hard for me. And then it wasn't until I was referred to an ear, nose, and throat specialist that led us down the path that we ultimately ended up going. It was the pre-admission testing that revealed an extremely elevated white count. And I got the call from the ear, nose, and throat specialist that nobody ever wants to get, and it was, Mr. Brown, there's a problem with your blood work. We need to refer you to an oncologist, hematologist, to get some answers here, and then we'll figure out what the next steps are. And that was the first time that my wife and I, heard the words chronic lymphocytic leukemia. I really felt that I was too healthy to get sick, and I really felt that my lifestyle was indicative of a clean bill. But I was then able to kind of shift the mindset from I'm too healthy to have it to I'm healthy enough to beat it.
And then Steve did this really long run up this big hill and let out this huge cry, and like a battle cry, like, I'm ready. And it was a very pivotal moment for us. It really kind of stuck us together, like we became a team, even more than, we've been in the past.
I started chemotherapy right after my 46th birthday, and I had no idea what to expect. My long days, I could be in the chair 5-6 hours. It was a long, long, long day. So I knew for the next 2 years, I was committed to chemotherapy type of a treatment to put me in remission. 2016, I didn't feel right physically. My lymph nodes were extremely large. There were some lymph nodes on my neck that were literally the size of a lemon. So this time around, my doctor said that his experience with BENDEKA was that he was pretty comfortable that that's probably the direction that would be best for me when it was time to treat again.
BENDEKA is indicated for the treatment of patients with CLL. BENDEKA is not right for everyone, including patients with a known allergic response to any of the ingredients in BENDEKA.
The protocol would only be 2 treatments every 28 days for anywhere from 4 to 6 cycles. And the days that I received BENDEKA was a short infusion. I was in and out quickly.
BENDEKA may cause serious side effects, including low blood cell counts, infections or recurrence of infections, unexpected responses to BENDEKA when placed in your blood, sudden and severe allergic responses, kidney failure due to fast breakdown of cancer cells, other cancers, and leaking of BENDEKA out of your vein and into your surrounding skin.
Finish up with some speed work on the straights. I got very, very involved with the Leukemia and Lymphoma Society's Team in Training, which is one of their flagship fundraising organizations. They train wannabe triathletes and cyclists and marathoners in events across the country. And given my love for the sport, it was kind of a no-brainer that I wanted to get actively involved with that organization. They get to work with a coach who's living proof that the work that they're doing is paying off. I can at least help alleviate some of the pressures, and more importantly, I can let them know that they have an ally in the process. Do you have any sevens? I tell people all the time that I've lived a very charmed and lucky life. So the fact that, I'm forced to live with a chronic disease, okay, but I've got treatment drugs that work, and the journey that it's taken me along the way, I probably wouldn't have traded that for anything.
Tell your doctor if you have any side effects, including signs of an allergic reaction during or soon after your infusion with BENDEKA injection, signs of infection, or other side effects. Some serious side effects may require dose reductions, stopping the use of BENDEKA, or waiting longer than expected between doses. BENDEKA can cause fetal harm if taken while pregnant. Patients should tell their doctor about non-blood related and blood-related side effects that may occur with BENDEKA. You are encouraged to report side effects of prescription drugs to the FDA. Visit www.fda.gov/medwatch or call 1-800-FDA-1088.